Good morning, everyone. Today is day 4 post my advanced lift and upper blepharoplasty. Day 4 if you include surgery as day 1. Yesterday I had a considerable amount of swelling. I still have it today. I do feel like the side on my cheek is starting to go down. This side is definitely more swollen. My pain level is at a 0. Last night I did have some discomfort around my ear area here. And you can see the lobe is a little swollen. There's a little aquaphor on there too. I just did my morning routine where I cleaned off my incisions and put the aquaphor on. I'll get back to that in a second. So last night I was having a little pain wearing the chin strap. I have it off now because I just washed my face and took care of my incisions, but so there's like a few little sutures around here, and this side for some reason was a little spicy. So I just took 2 ibuprofen and I was fine. No big deal. But honestly, considering the procedures I've had, having almost no pain this entire process is pretty amazing. So for me at least, pain has not been an issue. And if that's something you're worried about, of course I cannot speak for everybody, but so far, this has not been a super painful process to go through. So as far as my incision care that I did this morning, so I just use like a fragrance-free facial cleanser like CeraVe. And I just take like a cotton round like this, and I get it really, really wet, and I put just a dot of the cleanser and I foam it up because I don't want it to be, soapy, so soapy that I can't get it out. And I don't want to like douse my incisions with water. So just enough to like clean it off and get any crusties off gently, gently. Obviously you don't want to disrupt any staples or stitches, but you will see some crusties that are wanting to come off. So I do that, and then I get a clean one with just water and dab it just to get any remaining soap that might be there. That's just a technique I've done. I know that you can wash your face and just kind of let that foamy lather kind of graze over those areas. I think the key is just to be gentle and make sure you do get any soap off of that area. And then I take my Q-tips that were provided for me, and I try and use different Q-tips for my eyes versus my hairline versus around here, just to try and not cross-contaminate areas. I'll put a glob of the aquaphor in the back of my hand so I'm not dipping into the tip of the tube, just to try and keep everything really sanitary. Those are some tips that have worked for me. Everybody's different, so I'm just sharing. You've probably noticed that I'm not wearing a button-down shirt anymore. I think by the next day, once I had that big head wrap off, as long as you have a stretchy enough shirt that you're not causing trauma when you're pulling it on and off, you'll be fine. So yeah, I'm hoping to see the swelling start going down maybe later today or tomorrow. I'm still in cabbage patch mode here. I'm just gonna kind of show you both sides of my face. So other than the way my face looks, I feel fine. I mean, I feel like, my eyelids feel like a little puffy, but they don't hurt. And other than the tightness in my face from the swelling and the puffiness in my eyelids, I feel like it's just a regular Sunday and I want to go hang out with people. And I don't know that I'm public facing ready yet, but I did have some visitors stop by yesterday, and that was great. It was great to socialize. I think today, if it's nice out, I'm gonna, cover up with a hood, some sunglasses, definitely keep my face protected from the sun, and maybe get some fresh air and go for a walk. So I will report any significant changes today. If not, I will see you guys tomorrow.